Good afternoon, everyone, and welcome to our first council meeting of 2022. Happy New Year to everybody. First of all, moved by Councillor Wardrop that the agenda be adopted. All in favor? Okay. We would like to acknowledge the traditional territories and the oral practices of the Blackfoot Nation, which include the Siksika, the Kainai, and the Piikani. We also acknowledge that the Statina, the Stoney Nakoda First Nations, the Métis Nation Region 3, and all people who make their homes in Treaty 7 region of Southern Alberta. We're making this acknowledgement to demonstrate our continuing efforts to work together as we strive for reconciliation through increased and collective learning. Okay, moved by Councillor Goodenough that the minutes from the regular council meeting held December 20th, 2021 be approved. Any discussion? All in favor? Carried. Okay, moved by Councillor Prentice that the following items of correspondence be received as information. Any updates on council conferences or workshops? And the accounts payable listing, and nothing about your New Year's Eve parties, please. We'll start at that end. Councillor Idris? Nothing. Yeah. Councillor Nesbitt? Nothing exciting in your life? Nothing. Councillor Jessica? Yeah, our youngest one, Councillor Wardrop? Councillor... Yeah, I did, yeah. Bill had nothing, yeah. Okay. Any questions? All in favor? Carried. Okay, moved by Councillor Nesbitt that council accept the 2021 Recreation User Grant report as information, and Randy will speak to that.
Yes, thank you. Through the chair to mayor and council. So in 2021, City Council allocated $30,000 from the county annual ICF funding to the Brooks and District Recreation and Parks Board. The funding's to provide support for nonprofit recreation user groups in the city of Brooks for facility enhancements, equipment purchases, or support on capital projects. The funding program was named the Recreation User Group Grant, or RUG. The initial intake for RUG was June 1st through 30th, 2021. During that time period, 6 applications were received from local recreation groups, and 5 of those received funding as follows. So the Brooks Regional Ballpark Association received $4,145. The Brooks Bombers Baseball Association received $6,079. Brooks Gymnastics Club received $2,700. The Brooks Curling Association received $10,346. The Brooks Regional Bike Park Organization applied but did not receive any funding that year. And the Brooks Minor Hockey Association received $6,730, so the full amount of $30,000 was allocated to local recreation user groups. As part of the funding process, user groups are required to complete a follow-up form to demonstrate the completion of their projects and provide feedback regarding the application and grant process. All groups that received funding stated the application and follow-up processes were simple and easy, and that there were no suggested changes to the process from those user groups. The 2022 intake time period for RUG will be from February 1st through 28th, 2022, and that will be ongoing every year thereafter. Therefore, administration recommends that City Council accept the 2021 Recreation User Group Grant Report as information, and if anyone has any questions, be happy to answer them.
Anyone have any questions? Good. Okay, all those in favor? Carried. Okay, moved by Councillor Jessica that the COVID-19 updates and initiatives be accepted as information. Amanda?
Thank you. Through the chair to Mayor Petrie and council, the following is information regarding updates as relates to COVID-19. Data from January 3rd, based on the provincial's website dashboard, are as follows. The city of Brooks currently has 30 cases that are active. We continue with the 24 deaths within our community, and we continue to send our deepest condolences to those friends and family who have lost their loved one. As of January 3rd, there were 436 people that are hospitalized, with 61 individuals in ICU. 89.4% of the aged 12 and up population in the province have received at least their first dose of vaccination, with 85.3% of the population receiving two. More than 7.7 million doses of vaccination have now been administered in Alberta. On December 21st, 2021, Alberta opened COVID-19 vaccination boosters to all Albertans aged 18 and older while launching an ambitious booster shot campaign to protect Albertans from the rapidly spreading Omicron variant. Starting on December 21st, all Albertans aged 18 and older who received their second COVID-19 vaccination within the last 5 months can now book their third dose. Expanding the ability of the third doses of the vaccination will help provide increased protection and prevent community spread. You can book your appointments for third doses online with participating pharmacies or with Alberta Health Services by using the Alberta Vaccination Booking System or by calling Alberta Health Services at 811. New measures took effect on December 24th, focusing on avoiding super spreader events by decreasing contacts in large capacity venues and limiting unrestricted activities where there is a high risk of transmission. Albertans were also asked to reduce their social contacts by 50%. Large venues and businesses participating in the REP program had new measures come into effect on December 24th, and this started at 12:01 a.m. Capacity limits at large venues, so 50% if venue seating seats more than 1,000 people, 500 people if the venue seats between 500 and 1,000 people. No changes for venues under 500 people. No food or drink consumption in seated audience settings or during intermissions in venues with 500 or more individuals. Restaurants, bars, and pubs, there's 10 people maximum per table, no mingling between the tables, no interactive activities, and interactive activities are considered such as dancing, darts, billiards, etc. Liquor service ends at 11 p.m. and must close at 12:30 a.m. All other restrictions on indoor and outdoor social gatherings, weddings, funerals, places of worship, and businesses remain in place, and Albertans should also refrain from workplace social gatherings. Continue practicing good habits to protect yourself and those around you. Stay home if you are feeling sick, get tested at an AHS assessment center if you have symptoms, and take a rapid test before a gathering with other households took place before the holidays. At home, rapid test kits continue to be available, and you can pick up your one free COVID-19 rapid test kit at selected pharmacies, but these are for bigger municipalities within Alberta. However, you can certainly pick yours up here in Brooks at the Community Health Center. Each test includes 5 tests and instructions. The tests are intended for at-home personal use for regular screening in asymptomatic individuals or for those who may have had a recent COVID exposure. The test will aid in early identification of infections so people can isolate and help stop the spread. Again, there's a limit of 1 box, and that is within a 14-day period per person. Unvaccinated individuals must continue to obtain a negative COVID-19 test at their own expense administered through a private vendor or a pharmacy for both travel and the REP. If an individual has COVID-19 symptoms, they should utilize a rapid test if they have one. And for those who do not have a rapid test, they can book that PCR test through Alberta Health Services, or they can certainly go to the pharmacy. On December 31st, the Alberta Health Minister announced that Albertans who have been vaccinated with 2 doses will only need to isolate for 5 days instead of the usual 10 days if they test positive for COVID, which started on January 3rd. The province made this move due to evidence showing vaccinated people having shorter infectious periods. Vaccinated people who have symptoms that persist beyond the 5 days must continue to isolate. Those who are feeling better must continue to wear a mask in all situations outside their home for the 5 days following their isolation. This also includes no eating and drinking outside of the home for the 5-day period following isolation. People who have not been vaccinated must continue to isolate for at least 10 days following a positive test and must isolate beyond those 10 days if symptoms persist. Kindergarten to grade 12 students have had their winter break extended to January 10th. Diplomas have also been canceled due to the pause to return to school. 8.6 million rapid test kits along with masks will be distributed to schools for each student and staff member to receive 2 5 rapid kit tests or rapid test kits. The city recreation facilities are continuing to operate within those provincial restrictions and guidelines in place. Masking and physical distancing are required while in facilities unless engaged in physical activity. For more information or clarification regarding COVID-19, you may visit alberta.ca, the city's Facebook page or website. And this concludes the COVID-19 report, and city staff would be happy to answer any questions that you may have.
Any questions? I'm just kind of curious, maybe Randy, or maybe you can answer, just how did it go with the bandits? I wasn't there on January 1st, but it seemed things went well with that.
Yeah, through the chair to Mayor Petrie. So they had to reduce the capacity to 50% of fire code, so they did that. And the concessions and alcohol sales and all that couldn't operate either. So vending machines have to be put out of order. Basically, there's no food or drink allowed in the CRA because it is over that 500 total capacity. So.
Yeah, and the other one too, and I don't know if we know an answer to this, when does this come off? Well, I guess it depends on the numbers.
There's no set deadline. We don't know when the restrictions will cease or be lowered.
Okay, oh, who had a question? Oh, Mohammed. Okay, yeah, go ahead, Mohammed. Or Councilor Idris.
Thank you. The rapid test, and especially the idea of the one per person. I've heard some confusion around the idea one per person, one per household. People went to the hospital here, and they were told that it's one per household. And when you have one per household, it's a one-time use. That means so that idea, as Alberta Health says, do it for 2-3 days after a negative test could be an issue.
Yeah, go ahead. Yeah.
I can answer as relates to if you have 4 individuals in your household, each person should receive a kit, which includes those 5 rapid tests. So really, it shouldn't be one kit per household. It should be one per person. I just know from own experience, I went to community health and was able to get my rapid test, and I know there's other individuals that have received the kits per person as well for their home. I believe that if there is someone that has tested positive within your home, that if you have someone who's tested positive, let's just say it's myself and maybe one of my sons that are in my household, if he's tested positive, then I would test myself. If I've had a negative test, then I would retest myself within the 24-hour period.
Just, it is a little spotty, though, those rapid tests, because Alberta Health Services does have them some days. The next day, they don't have them. They say, come back, or come back later this afternoon. Yeah, and especially, again, in the rural community, I think we're at a disadvantage on that. So that's the sad part about that anyway. So hopefully that can change in the next little bit there, too. Any other questions? Councilor Jessica?
Yeah, so I believe we're not involved in enforcement of any of these guidelines, or not directly. But has anybody had any feedback from the people, I guess, RCMP that do enforcement, as to whether anybody has been shut down or for contravention of the guidelines?
Yeah, okay, Amanda.
I am not aware of any.
Okay. Any other questions? Okay, to the motion that the COVID-19 updates and initiatives be accepted as information. All those in favor? Okay, carried. Thank you. Okay, moved by Councilor Idris at the meeting. Oh, just wait. Got to talk to Sandra. Sandra, are you on the line? Oh, she's not on the line. Okay. Moved by Councilor Idris that the meeting move into camera at 4:43 p.m.